I work with patients mostly on quitting smoking, and also along with that, addressing some of their other health-related goals and priorities. So that could include improving their health in other ways through things like increasing their physical activity or learning tools to better manage their stress. I work with people to personalize a quit plan. We talk about the different medication options that can go along with quitting smoking, and we also talk about the habits and routines that go along with smoking. So by learning more about those routines, we can also learn more about other activities that they might be able to try out to take the place of those and allow them to stay smoke-free over time. Most people make many attempts to quit before they're able to quit for good. And the good thing is that every time someone makes an attempt to quit, they get an opportunity to learn more about their habits and routines, to make it through some challenging situations and cope with cravings, and to learn more about the treatment strategies that worked or didn't work. The great thing about quitting smoking is that there are medical benefits that kick in, even as little as several hours since your last cigarette. Your blood pressure goes back to normal, and really the medical benefits accumulate from there. And so it's rewarding to work with people who are continuing to challenge themselves and stay smoke-free over time, because the benefits just continue to build.